We'll go ahead and get started in just a minute. We're scheduled to start at 8:30, and we are so pleased that y'all are here with us today. Can everyone hear me okay in the back? Awesome. My name is Jenny Calhoun, and I'm a nurse consultant with the Virginia Department of Health, and I've been working in public health, HIV, and STI for 30 years, and nursing is my second career. So I love working with the people I work with. And we are just pleased to be here with y'all today to talk about Mpox for healthcare providers. We've got some wonderful speakers ahead for you. But before we get there, I wanted to go ahead and do a little bit of housekeeping. If you haven't already, please sign in the front. We have our wonderful Medical Reserve Corps volunteers, Jim and Deb, that are helping us this morning. So make sure you sign in. That's the way you're going to get your credits. If you're applying for CMEs or nursing credits. As far as emergency exits, the main exit that you came in is the main exit to get out. There is another exit, but it's a little more complicated to get to. So I would suggest, unless there's a fire right at the exit, go out the way you came in. As far as morning refreshments, please help yourself. There's water, juice, coffee, pastries, and all kinds of good things from Celebrity Deli. And as far as restrooms, when you go out the door, go to your left, and at the end of the hall, they're right around the corner, and they're really cool. They've got touchless exits. So I'm impressed at like bathroom technology because I used to be the infection control trainer. It's about washing your hands, so that's pretty impressive. And then if you're able to, please either turn your cell phone off or at the very least put it on vibrate or silent so that we can listen to our speakers. We understand many of y'all are very important. And or all of y'all are very important, but you may get some calls that you need to take, but just step outside. And then also, if you are applying for credits, please make sure that you complete the program evaluation by the close of business on January 31st, which is next Wednesday. Also, I want to let you know that some of the information we have out on the tables, we have, even though we're talking about Mpox today, we know that diseases and infections don't always travel alone. There's a packet of information for providers around syphilis. Syphilis has been in the news a lot lately. Back when I started in public health, we thought syphilis was on its way out, and I can't take credit for it, but it's still here and booming. But in that packet, you'll find there's a nice little handy dandy CDC treatment guidelines booklet, and then there's a lot of information about syphilis, STI screening recommendations, as well as other materials, taking a sexual history, and also just a list of what the reportable diseases are if you or someone in your office isn't sure what they're supposed to report. And then there's also some information explaining what the disease intervention specialist does. So if you haven't met your DIS or disease intervention specialist in your area, I do encourage you to reach out and find out who they are. They can be critically helpful in getting our people treated when they need to, and also to get their partners taken care of. I also, because we are able to offer CMEs and nursing credits, I need to show you this accreditation statement that basically says that VDH and VCU Health have jointly come together to be able to accredit this presentation, and you can earn 3 hours. I'm going to acknowledge that there's no commercial support, in-kind support, or there's also no exhibits supporting this activity. The planning committee, which we're grateful to have here this morning, Donald Moore is our training coordinator from VDH, and he's done an incredible job getting us here today and setting us up in this beautiful room. We have Safri Diawara, who is also from VDH and HIV Care Services, he'll be speaking to you a little later. Lauren Lee, who's going to be coming up after me. And then also not with us today is Susie Silverstein. Well, they are with us, just not in this room. Susie Silverstein and Sue Skidmore were also instrumental in getting this presentation and workshop ready for us. For our speakers today, Dr. Lauren Lee, Dr. Jorge Ramayo, and Dr. David Wheeler also have nothing to disclose. And I've pretty much already given you the opening remarks and kind of introductions the way we went along. I also wanted to mention we have some esteemed people here from Nova Salud, and they put some materials out on the tables as well. They're one of our community-based organizations that has done a lot of work since the beginning of the Mpox outbreak last year, and we really appreciate that. So definitely there's some materials out there about what Nova Salute does, and then the work that they're doing with Mpox, trying to get people vaccinated, providing transportation and that sort of thing. So that's, thank you so much, Nova Salute. The way the day will go, we've had some time for registration refreshments, and here I am talking to you. Dr. Laura Lee is going to be doing the Mpox overview next. Then Dr. Ramayo will do the Mpox vaccination. We'll take a short break. Then we'll come back. Dr. Wheeler will go over Mpox testing and treatment. And then the part we're really excited about, we'll have our roundtable panel discussion with Dr. Wheeler and Dr. Ramayo and all of you. And at that time, you can share some of your experiences if you'd care to. Then we'll say a few things and then we'll get on our way.